my YouTube channel. Today we will discuss the anatomy of ulna. Ulna is the long bone of upper limb. It is homologous to fibula of the lower limb. Come to the site determination of ulna. Ulna is divided into three parts. Upper part, middle is known as the shaft, and the lower part. Upper part contains a hook-like projection, and this is known as the olecranon process, and this process is known as the coronal process. Into the shaft, this border is very sharp, and this is known as the lateral border of ulna. Lateral border of ulna is very sharp. It is very sharp. And the lower end, which contains the head, this is the head of ulna. This is the head of ulna, and a process. This process is known as the styloid process, and which is directed medially and downward. So, according to these features, this ulna is on right side. This ulna is related to the right side. The external features of ulna. Ulna is divided into upper part, that is the upper end, middle is known as the shaft, and the lower end. First, upper part or upper end. Upper end contains two process and two notch. Okay, two process. This is the upper process is known as the olecranon process. This process is known as the olecranon process, and this process is known as the coronoid process. This process is known as the coronoid process. This notch is known as the trochlear notch. This notch is known as the trochlear notch, and this notch is known as the radial notch, and this notch is known as radial notch. Okay, come to the olecranon process. Olecranon process contains the surfaces. This is the superior surface, this is the anterior surface, this is the anterior surface. Behind the posterior surface, this is the posterior surface, this is the medial surface, and lateral surface. Okay, so total these are the surfaces of olecranon. Then come to the coronoid process. Coronoid process contains, this is the superior surface. Okay, this is the anterior surface. Okay, medial surface and lateral surface. Okay, these are the surfaces of coronoid process. This is the notch. This notch is known as what? Trochlear notch, which are articulated with the trochlea of the humerus to form the elbow joint, which form the elbow joint. This is the radial notch, which are articulated with the head of radius and form a superior radioulnar joint. Form a superior radioulnar joint. Shaft of the ulna is having three borders and three surfaces. This is the sharpest border. The sharp border is known as the lateral border. This is the anterior border. This border is the anterior border, and behind this is the posterior border. Okay, so anterior border, lateral border, and the posterior border. These are the three borders. Now come to the surfaces. A surface in between the anterior border and the lateral border is known as the anterior surface. This is the anterior surface. A surface in between the lateral border and the posterior border, it is known as the posterior surface. Surface which comes between the anterior border and the posterior border is known as the medial surface. This surface is known as the medial surface. Now come to the lower end. On the lower end, which having the head, this is the head of ulna, which are articulated with the ulnar notch of the radius, which form the inferior radioulnar joint, and this process is known as the styloid process. This process is known as the styloid process. On the upper end, having a tuberosity, and this tuberosity is known as the ulnar tuberosity. This tuberosity is known as the ulnar tuberosity. And the lateral border, it is the sharp border having the upward line towards the upper end, and this is known as the supinator crest. This attachment of the ulna on the upper end. This is the olecranon process. On the superior surface of the olecranon process, insertion of triceps brachii muscle. Insertion of triceps brachii muscle. On the posterior surface, insertion of unconeus muscle is there. Insertion of unconeus muscle is there. On the supinator crest, supinator muscle is originated. On the supinator crest, supinator muscle is origin. On the medial side of the upper end, pronator teres muscle is origin, and along with that, flexor digitorum superficialis muscle is origin on the medial surface of the upper end. Onto the lower end of the anterior surface, origin of the pronator quadratus muscle. Origin of pronator quadratus muscle is there. Anterior surface and the medial surface, where origin of the flexor digitorum profundus muscle. It is the huge muscle which are origin from upper part of the anterior surface and upper part of the medial surface of the ulna. Flexor digitorum profundus muscle. On the posterior surface above 1/3 part, where originating of abductor pollicis longus muscle. Origin of abductor pollicis longus muscle. On the middle 1/3, origin of extensor pollicis longus muscle. Extensor pollicis longus muscle. And lower 1/3, origin of extensor indicis. Extensor indicis. Abductor pollicis longus, extensor pollicis longus, and extensor indicis. The lower ossification of ulna. Ulna ossify one primary center and two secondary center. One primary center for the shaft, which are appear 8 weeks of the intrauterine life. 8 weeks of intrauterine life. One secondary center for the olecranon process, which are appear 10th years of life and fuse with the 16th years of life with the shaft. One secondary center for the lower end, which are appear 5th years of life and fuse with the shaft at the age of 18 years. These are the ossification centers of ulna. Anatomy of the ulna. Olecranon process is the commonest site of the fracture of ulna. The most common site of fracture is olecranon process. Elbow joint is dislocated, so that this is the one of the commonest site where the olecranon process shift to posteriorly. This is the dislocation of the elbow joint. Now, a Midland deformity. Into the Midland deformity, dorsal subluxation of lower end of the ulna is there. It is known as the Midland deformity. So, it is all about the anatomy of ulna. Thank you very much for watching this video.